Hi guys, it's me, Professor D, and welcome back to my YouTube channel. On this video, I'm going to be covering NCLEX testing tips. This is definitely going to be a multi-part series because there are lots of tips to go through. Now, 99.9% of the time, I review the material before I cover it, but I had a long day. I haven't had a chance to do it, and I wanted to make sure I got the material to you. So I'm going to be seeing this material the same time that you see it. All right. Now, if there's anything that's crazy on there or that I don't agree with, I'll let you know and I'll elaborate further. But I'm letting you know this list, I have not reviewed it yet. So we're looking at this at the same time. But the stuff I have is usually legit, so I'm not worried. Before we get started, please do not forget to support this channel by liking this video, subscribing to my channel, engaging with me in the comments. Let me know what you think about this video. Let me know what you'd like to see me cover. Don't forget, I have audio lessons available for you on my website, nexusnursinginstitute.com. Now, these tips, I think I looked very quickly because there's about 4 pages worth. I think there's like 134 of them. And like I said, obviously, these are a lot of tips, and I'm not just going to read them to you. Some things are pretty self-explanatory. I might not have to explain everything, but for the most part, as I read them, I'm going to make some comments or something that can help you remember this content. So let's look at number 1. What does it say? When getting down to 2 answers, choose assessment answers such as assess, collect, auscultate, monitor, palpate. Choose the assessment answer over the intervention except in an emergency or distress situation. If one answer has an absolute, discard it. Give priority to answers that deal directly to the patient's body, not the machines or equipment. First of all, everything in this is correct. This is absolutely correct. But I feel like this number 1 should have been like 3, maybe even 4 points. So let's talk about it because there's some very important things that you need to know about, regarding this number 1. Software update. No, not now. Cancel. Okay, so let's talk about choosing the assessment answer first. If you're down to 2 choices, it's said to choose assessment. I agree with this to a degree because let me explain this to you. Some questions that you get in the body of the question, they gave you enough information to let you know you already did the assessment. So for example, if it's a question about a patient that had an MI, now they didn't tell you that that patient had an MI, but they told you that the patient has a history of high cholesterol, eating fatty foods, and now the patient is clutching their chest, saying that they have chest pain. They're saying that they feel like an elephant is standing on their chest. The heart rate is increased. They're giving you vital signs. You might even get some labs, right? So they're giving you enough information that you assessed. What are you going to do next? ADPI, assessment, diagnosis, planning, intervention, evaluation. So the next thing you're going to do is actually intervene to help your patient, right? So really, when it comes down to 2 choices, assessment and intervention, you're going to choose assessment if you don't have enough information to let you know exactly what's going on for you to do something for your patient. Do you understand what I'm saying? So most of the time, when you're down to assessment and intervention, you're going to choose assessment. But there are some situations they've given you more than enough information to show that you've assessed this patient thoroughly. It's time to intervene. What is your next move? Right? So a simple example would be a patient that is having difficulty breathing. You walk in the room, you see that they're having difficulty breathing because you see them using their accessory muscles. You see the nasal flaring. You see that their O2 sat was only at 91%. So at that point, are you going to be trying to do more assessment? No, you're going to intervene. Even something as simple as what? Having them sit up. Because having that patient sit up, you're helping the diaphragm so that gravity can help that diaphragm push down. So when the patient takes a deep breath, right, they can get more oxygen into their lungs. You're removing or releasing the abdominal girth that's pressing up against their lungs so they can't breathe. Something as simple as sitting that patient up is a nursing intervention that you're going to do. You're not going to waste time assessing further when you already know enough information to do something for your patient. So I kind of wanted to bring that to your attention. So be careful with that. If you're down to assessment and intervention, say to yourself, do I have enough information to do something for my patient? If you do, intervene. And if you don't, assess. But what I don't want you to do is choose assessment just because it's there, because sometimes the test writer will throw an assessment in there just to throw it in there, and you're over here wasting time with unnecessary assessment when you could have been saving your patient's life. All right, so I got that out of the way. Now let's see what else it said. If one answer is an absolute discarded, I agree. How many times have I told you guys about all-inclusives? Stay away from those always, never, only. Do not choose an absolute unless you know beyond a shadow of a doubt that that's your correct answer choice. Give priority answers to answers that deal directly to the patient's body and not the machine or equipment. I agree 100%. You're always treating the patient and not the machine. The patient comes before paperwork. So I agree with that thoroughly. All right, let's look at number 2. Number 2, it says keywords are very important. Avoid answers with absolutes. I cannot stress this enough. Stay away from them unless you know for sure that that's your answer. So examples, always, never, only, don't choose it unless you know for sure that's your answer choice, guys. Absolute gives you no wiggle room. Always, that means there's no exception. Only, that means there's no exception. Never, that means there's no exception. And guess what? 99.9% of the time, there's always an exception. So don't choose that unless you know for sure that's your answer choice. Number 3, with lower amputations, patient is placed in prone position. Absolutely. So I want you to think about it. This patient's had a below knee amputation. So what's going to happen is their leg is going to what's left of that leg is going to want to elevate, right? And so that patient can have hip contractures, and you don't want that to happen. So what you're going to do is place them on their stomach, and you're going to do that several times during the day to make sure that those contractions do not develop. 4, small frequent feedings are better than larger ones. Absolutely, small frequent meals. Why? Because small frequent meals decrease the risk of GI irritation, such as that patient having being nauseous, wanting to vomit, having abdominal distension, right? It decreases the risk of that happening. So you always want not always, but for the most part, smaller and more frequent meals than 3 large meals. 5, assessment, teaching, medications, evaluation, and unstable patient cannot be delegated to an unlicensed assistive personnel. And unlicensed assistive personnel, they do not have a nursing license. So that assessment, first of all, the initial assessment, the in-depth assessment, that has to be done by the registered nurse, not even the licensed practical nurse. Now, the LPN or the LVN can come behind that registered nurse after the initial assessment has been done and do their own assessment, because guess what? If they're giving an anti-hypoglycemic or medication, do they just give it? No, they check the patient's blood sugar, or they look at labs, before they give a medication. Remember, assessment is not only a physical exam of the patient. Assessment is anything you do to get information. If the LPN's about to take the patient's blood pressure before I gave you the answer. If the LPN was going to give the patient an anti-hypertensive, aren't they going to take the blood pressure first? So yes, LPNs absolutely do assessments. What they don't do is the initial assessment, the in-depth assessment, the admissions assessment, okay? So if even the LPN does not do that, how are you going to give that to an unlicensed assistive personnel? You cannot. Assessment, teaching, medications, evaluation, basically, and I don't say this to be disrespectful, I'm just saying this in a way so you guys can remember for testing purposes, anything that requires critical thinking, you can't delegate to the unlicensed assistive personnel, right? Things such as assessment, things such as evaluation, things such as teaching. Number 6, the LVN, LPN can't handle blood. And this is a general rule. I know there are some states, from what some students have told me, they can. Listen, and I've been doing this for a long time, I don't know of any states that the LPN can do blood transfusions. However, you check with your state. But for testing purposes, that is something complex. That is something the registered nurse needs to handle, not the LPN. Number 7, aminoglycosides. Matter of fact, Venco is a very important aminoglycoside to know. It's the most common aminoglycoside that you're going to get on NCLEX if you do get an aminoglycoside on NCLEX. And look what it says. Aminoglycosides, like Venco, can cause nephrotoxicity and ototoxicity. Very important to know. For NCLEX purposes, if you see that that patient has been prescribed an aminoglycoside, you better be looking at those labs. You better be looking at that BUN, that creatinine, that GFR. You better be checking your patient's urine output, because we know it's very harmful to the kidneys. You better be checking that patient's hearing, or asking them about their hearing. Have you been having any ringing in the ears? Have you noticed any deficits in your hearing? Okay. Aminoglycosides are very potent drugs. And so you have to keep your eye on that patient. The patient's taking aminoglycosides. And guess what? Aminoglycosides are not our first line antibiotics, because they are very hard on the body. I did a whole video on aminoglycosides. If you're interested in that, or you're taking pharm, because I promise you need to know them, check my pharmacology playlist and watch that video on aminoglycosides. It's very in-depth. You need to know it. Number 8, IV push should go over at least 2 minutes. I think as nurses, you guys hear push and you think it means just to push that medication. But no, remember, this medication is going directly into that patient's bloodstream. You're not trying to kill them. If the patient is not a child, an answer with family option can be ruled out easily. So when you're doing questions for peds, that's when you're usually you can choose answers that have something to do with the parents, because it's peds, right? The parents are the ones making the decision. And plus, pediatrics, when you're dealing with them, they're very afraid because they're sick. They're in an unknown environment. So you want to get the family involved. But when it comes to an adult, if that adult is with it 100% cognitively speaking, you'll hardly ever have the family as an answer. Okay. Number 10. In an emergency, patients with a greater chance to live are treated first. I actually talked about this on one of my videos I did on disaster triage or triage care. But the point is, normally, right, when you're triaging a patient and you get test questions such as you're in the ER, right, you're always going to take that patient who's the illest, who's most at risk for dying. That's going to be your priority. But when it comes to disaster, it's switched. You want to help the person who's most likely to live, the person who has the highest chance of living. Why? Because when it comes to disaster, you're trying to save as many people as possible. So I know it sounds really bad and it sounds very callous and cold, but that's just a hard truth. For testing purposes, if it's a disaster, the people who are worse off, leave them. Go to the person who's most likely to live. That's who you want to help first, okay? Number 11, ARDS. ARDS is acute respiratory distress syndrome. ARDS, fluids in the alveoli, and DIC, that's disseminated intravascular coagulation. That's when that patient will clot, then they bleed. They clot, then they bleed. They clot, then they bleed. It's a horrible cycle. So anyway, ARDS and DIC are always secondary to something else. So what happens is when that patient has ARDS or they have DIC, you really want to figure out what the underlying cause is and fix that so that we can effectively treat that ARDS and DIC. Cardinal signs of ARDS. When you see that word cardinal, that means classic, hallmark, cornerstone, right? Cardinal signs of acute respiratory distress syndrome is hypoxemia, not having enough oxygen in the blood. Remember, guys, that oxygen in the blood, that's what causes perfusion of the tissues. Those tissues cannot survive without being perfused. So the cardinal signs of ARDS is hypoxemia, low oxygen level in tissues. Number 13, and pH regulation. The two organs of concern are the lungs and kidney. I've talked about this on numerous occasions. I'm looking for, okay. So, when it comes to pH regulation, the name of the game, guys, is homeostasis. You want your pH to be between 7.35 and 7.45. 7.35 is the lowest, 7.45 is the highest. That is homeostasis for pH balance. Lower than 7.35, the patient's going to be more acidic. Higher than 7.45, the patient's going to be more alkalinic or basic, right? Okay. Oop. With that being said, I'm trying to keep us on track. Okay. So with that being said, I lost my train of thought. Give me a second. What was I talking about? Homeostasis. Okay. Yeah. So the lungs and the kidneys. The lungs are responsible for carbon dioxide. Carbon dioxide within itself is what? Acidic. And the kidneys are responsible for bicarb. Bicarb within itself is what? Alkalinic or basic. So when the body has too much alkaline, it's too basic. What's the lungs going to do to try to help? The lungs going to try to hold on to the CO2 because that's all the lungs responsible for. The CO2 is going to hold on to the CO2 because remember I told you the CO2 is acidic to try to balance things off. What if the patient has too much acid? What's the only organ that can help? The kidneys. What this kidneys going to do? Hold on to the bicarb to try to do what? Balance things off and keep the pH between 7.35 and 7.45. Let's say the patient is too acidic, right? And I told you they're too acidic. Kidneys will try to help by holding on to the bicarb to balance it off. But what can the lungs try to do to help as well? Remember, the only thing the lungs can do is control the CO2. So the patient, if the patient's already acidic, and we know that CO2 is acidic, and we know that the lungs control the CO2, what do you think those lungs are going to do? Blow off that CO2. Try to get rid of the CO2 so that they can become more balanced. And in that same situation, if that patient is too alkalinic, they're too basic, we already know that the lungs can make the patient hold on to their CO2 to bring balance. But what can the kidneys try to do to help if the patient's, what did I just say? Did I say the patient's too alkalinic or basic? I don't remember what I just said. If the patient, maybe I said patient's too basic. So if the patient has too much base, right? The lungs will hold on to the CO2, but what can the kidneys do? Yeah, that's what I said. What can the kidneys do if the patient's too alkalinic? They've got too much base. The kidneys can get rid of some of that bicarb, that HCO3, through what? The urine. Okay. I'm lying to you. I said the urine. I meant feces. Just joking. Just joking. Base out the butt. Just joking, guys. Base out the butt. So the patient can lose that HCO3, that bicarb through their stool. Base out the butt. So that is very true. When it comes to pH balance, it's the lungs and the kidneys. The lungs for CO2 and the kidneys for bicarb. HCO3. 14, it says edema is in the interstitial space, not the cardiovascular space. Oh my gosh. This is so important for you guys to understand, because this is why you get a lot of those burn questions wrong, because you don't understand this concept. Guys, don't mind my twist. I have a speaking engagement at a school tomorrow, and I'm wearing a twist out. So I'm not messing up my twist out tomorrow for this video. So you guys are going to take this video how you see me. No complaints. All right. Let's talk about this. Edema is in the interstitial space, not in the cardiovascular space. So I want to talk to you guys about this. So you know how patients have a severe burn, right? And because of that severe burn, all of the fluid that was in the vascular space, that was in the vessels, it leaves, right? Because there's not enough protein within that vascular space to keep the fluid there. Remember, it's the albumin that keeps fluid within the vascular space. Once that albumin's gone, that fluid's like, oh, we're out of here. And the fluid leaves that vascular space too. And so as students, you guys get confused. You always are like, okay, we know that when it comes to burns, the patient's going to be all swollen. How are they dehydrated? Remember, when we're talking about dehydration, we're talking about fluid where? In the vascular space. So even though that patient who's gone through a severe burn, remember, we take off their watch, we take off their tie, anything that's restrictive, we take off that belt, anything that's restrictive, we remove, because we know that patient's going to swell up. The reason they're swelling up is all of that fluid that was in the vascular space. And remember, that fluid that was in the vascular space also contains the oxygen, the vitamins, the fluids, the electrolytes. All of that fluid that was in the vascular space leaves to go out to the tissue wherever that burn is to help out, to bring perfusion. So even though that patient looks bloated, they're swollen, they're looking like this, they're dehydrated because the fluid has left the vascular space. And the problem with this, that fluid that's supposed to be in the vascular space, that's what's supposed to be perfusing your organs, such as your eyeballs, your liver, your kidneys, your spleen. And that's why when the patient has gone through a severe burn, it is a priority to give them fluids. We're giving them fluids hard and fast. Preferably lactate ringers, because lactate ringers has like the closest like consistency as the blood. So when we give them that lactate ringers, we want that fluid to stay within the vascular space and not leave and go out to the tissues. So, you know, when it comes to burns, yes, besides, you know, pain management, yes, besides infection control, a priority is what? Fluids. So that's very important for you guys to understand. And I'll do one more because I have to get going. But I think on the next video, I think I'll do these videos 15 at a time. 15, weight is the best indicator of dehydration. How many times have I told you guys that? And that students, you guys get this wrong all the time. You'll want to choose skin turgor, right? Or urine output INO. It's weight. That is the best indicator of fluid balance. And so what you want to do is weigh that patient every day, at the same time every day, in the same type of clothes, on the same scale. And that weight is the best indicator of letting you know if that patient is holding on to fluids or letting go in cases such as what? CHF. All right, guys, so we covered the first 15, lots more to go. Like I said, there's 100 something of these, but so far, these are pretty legit. These are some real good test taking tips. So there'll be a new video coming soon. Please, guys, let me know what you thought about this video in the comments. Don't forget to please engage, help my algorithm. I can't respond to everybody, but I promise I read your comments. So please let me know what you thought about this video. Don't forget I have audio lessons available for you on my website, nexusnursinginstitute.com. And almost every single day, you guys can watch me cover different types of questions on my social media platforms, such as TikTok, Instagram, and Facebook. Thank you so much for watching this video, and you guys will catch me on the next video.